Hi, I'm Dr. Barbara, and I'm working with the Human Resource Team and the COVID team at Montefiore and the Wiles to guide employees and residents in practices that keep everyone healthy and safe. I want to talk to you today about staying healthy and safe this spring and early summer as Cleveland opens up and people return to more normal activities like shopping, getting their hair cut, mingling with family, and recreating. It has been hard on all of us to restrict our activities and our religious observances in the past 3 months in order to keep ourselves, our families, our coworkers, and our patients safe. I had to watch my son get married by video stream instead of being there in person. He and his new bride could only have witnesses present at the ceremony instead of being loved in person by their families. As healthcare workers, we have had to take care of sick people and even support them when they pass away without them having the bedside vigil of their families. It's been difficult for all of us. Working at the Wiles and at Montefiore, we cannot socially distance the way our family and friends can do in the community. We have learned to wear PPE. We've learned to change our nursing and medical care to provide health care, but to keep ourselves and patients safe. Due to your vigilance and our teamwork, we have been able to limit the number of active COVID cases in our facilities to a handful of residents and staff. We can congratulate each other on keeping ourselves safe. I need to tell you, though, that as the city opens, we, Montefiore, the Wiles staff, all have to be vigilant about our exposures to prevent a second surge of cases. First, we need to continue to wear appropriate PPE at our duty stations. Those in the COVID unit wear the full paraphernalia from head to toe, the so-called bunny suits, with an N95 mask, face shield, gown, and gloves. Those employees taking care of residents outside the COVID unit in the AL and SNF wear either an N95 or a surgical mask and face shield if they are unable to tolerate the N95. Therapists, particularly speech therapists, take additional precautions. Those of you who do not have clinical responsibilities can wear the issued N95 mask or, if preferred, the surgical mask. We are now able to change the N95 twice per week and hopefully more often as the supply chain matures. The surgical mask should be changed daily, and either mask should be changed if it becomes soiled. Because we have responsibilities to our residents and to our coworkers, we, the employees of Montefiore and the Wiles, need to continue to maintain vigilance with social distancing, wearing masks or face shields in the community, and sanitizing our hands. Most of us have had low-risk COVID encounters in the community these past few months, and that low-risk nature has kept all of us safe. Now, with the city opening up, you may see activities going on around you that are medium or high risk. I want to tell you what we mean by low risk and give you examples of activities that hold higher risk level so that as you plan your activities, you can make them low risk and try to mitigate activities that could be medium or high risk. Low risk is any activity that you do which does not bring you into close proximity in an unprotected fashion with someone outside your household. So if you are running an errand in your car and let's say you're in a drugstore, the employee are wearing face coverings or masks, and you sanitize your hands before and after getting in the car, you have had a low risk encounter. If you pick up a child from college who's been away for a while and both of you wear masks and sit in different parts of the car and keep the windows open and sanitize your hand before and after the trip and after each rest stop, and sanitize the car inside afterwards when you're done, that's low risk. But even though your child is a part of your family, that child is no longer a member of your household for a while. And if either one of you has COVID and is asymptomatic, you can give it to the other. So you would need to take all of these precautions in order to make this activity low risk. If a new person enters your household, so for example, it could even be your mom or perhaps an adult child who's moved back in, he or she should stay in their room and use a separate bathroom, if possible, for 2 weeks. You two don't want to eat your meals together for those 2 weeks. Each of you should wear a mask if you're in the same room with each other, even for a short time. This exposure could be low risk to each of you if you follow these precautions for 2 weeks. If you are attending a wedding or a funeral with very few people, particularly outside where you can distance, that can be made low risk by wearing masks, even for picture taking, and by maintaining social distancing. Swimming can be low risk and fun. COVID is not transmitted in pool water as far as we know, but persons in the pool and out of the pool should keep their distance. Golf, tennis, hiking, jogging, cycling, kayaking, canoeing, these are all fun activities and they can be made safe as long as you maintain social distancing with anyone not in your immediate household, even if they are family. So I've just described to you examples of low risk encounters if you do them properly. And if you do, you're able to go back straight to work wearing your appropriate PPE. But there are activities out there that are medium or high risk by nature, and you may be excluded from working at Montefiore or the Wilds for at least a week, and even for 2 weeks, if you partake in higher risk activities. Here are some examples. Traveling by car and not protecting yourself or others with masks and hand sanitizer appropriately. Air travel at this time is probably more than low risk because of close proximity of people, recirculated air, eating and drinking on the plane, which of course you have to do without a mask. So we're rating it at least a medium risk until further data is available. Having somebody from outside your home move in without taking the precautions that we described, and attending family celebrations, reunions, parties, indoors particularly, or conversely, funerals and wakes that cannot by nature offer social distancing. If you're planning activities that are medium or high risk, we hope that you decide not to do them or figure out a way to lower the risk. Talk to your supervisor or to HR about how to mitigate the risk. You may have to take more PTO than you initially intended if your activity is not low risk. In summary, we want you to assess your activities and plans outside Montefiore. We want you to have fun. We want you to enjoy the spring and the summer, but medium and high risk COVID activities are going to be going on around you, and we hope that you'll avoid them. We want you to feel empowered to either change your plans and make activities low risk or leave them if high COVID risk levels are present, even if you and everyone around you looks healthy. This is hard to do, especially if you're one of the young persons in the group and not the decision maker. But we want you to be firm in your convictions and firm in your intentions to stay safe and maintain a low COVID risk for yourself, for the vulnerable people in your family, for your patients, and for your coworkers. If you have any questions, please reach out to me or to HR at the Wiles or at Montefiore. Thank you.